Hello, good evening. My name is Rosalind. In this video, I'm going to be talking about future career paths. Mainly, I'm going to focus on nursing because that is my career path. We've all been to interviews, job interviews, and one of the questions they tend to ask is, why do you want to work in this career field? What sets you apart from other candidates? If you're like me, you're thinking, I have bills, I need to put a roof over my head, and student loans. But we all know that's not how we're going to answer the question. So I tend to say, I wanted to do something in my career that is challenging, interesting, and make a difference in people's lives daily. And what I feel sets me apart from other candidates is my ability to sit with a patient and explain things in a non-technical way. I find in the healthcare field, we tend to ramble on and you use words that the patients don't understand. I can't tell you the number of times I've had patients show up to an appointment and they didn't even know why they were supposed to be there. They didn't know what was going on. And then I would say, did you ask the doctor? And they would say yes. So I've always felt like that is what sets me apart. I will take that time to explain what is going on, where I've seen others say, you should have asked your doctor should have told you, and I'm just not one for that. So I think that gives me a leg up, that I'm always going to take the time needed to be there for the patient. As a graduate of Excelsior, I would have to say the critical thinking course, the critical thinking piece and problem solving that was driven into every aspect of classes as I progressed through the nursing program. They emphasized how important critical thinking and problem solving is. And I will say, as a RN, I use my critical thinking skills daily. From the time the patient comes in, I'm gathering data, I'm assessing them, reassessing, coming up with a plan of care that is individualized to the patient. So if I have to think about skills that I use and apply from Excelsior College, it would be the critical thinking and problem solving skills. As far as nursing in the future, 10, 20, 30 years from now, or any career for that matter, I think one needs to always think, like, what's a future-proof career, if that's even a thing? It's like, which services will be crucial to people 10, 20, 100 years from now? And I will say the healthcare field, nursing will be critical. Not just the fact that we're fixing wounds, drawing blood, doing procedures, but that human connection part is integral to all patient care. The holistic, treating the whole person. I mean, you could get robots to do procedures, but are they treating the whole person, or are they focused on that one procedure? Are they focused only on the laparoscopic knee? But what if your patient has a variety of things going on? Can a computer really decipher that? No. The staying power and how you plan for the future in nursing is that you need to accept early on you will always have to continue education. And what I mean is, you'll either get certified in geriatrics, certified just to be an IV nurse. You'll go back and get your master's degree or PhD if you want to be an educator in nursing. So I think one of the key things, and it was in an article The future of nursing 2020 to 2030 is education and technology. They're going to go hand in hand. As we saw in the pandemic, there was a lot of use of telehealth, telemedication to provide care for the patients and to keep them safe during the pandemic. So when you're considering a career in nursing, know that it has staying power, but that staying power involves you continually keeping up with your education, keeping up with your certifications, and that willingness to adapt to technological advances that continue to be an integral part of nursing. Thank you and good night.